So what's PCOS? PCOS stands for polycystic ovarian syndrome. And that's where your ovaries get stuck in this cyst forming state. And you can see it on an ultrasound oftentimes. Sometimes you can't. But what are the symptoms of it? So it's where it's menstrual irregularity, and often elevated androgens that can lead to acne, hair growth in unwanted places, and sometimes hair loss from the top of the head. And what causes it? Well, it's really coming to be clear that it's caused by insulin resistance. And so insulin resistance I've talked about a lot, but that's where your insulin receptors that open a little door to allow glucose to leave your bloodstream and enter the cell where it belongs for energy production, the insulin receptors get insensitive or desensitized to insulin. So, and what causes that? Well, it's eating too much sugar and carbohydrate, and then having the pancreas have to release too much insulin. So you have higher levels of insulin than would be ideal for too long. And that bombards the insulin receptors on the cell membranes. And pretty soon the cell membranes, insulin receptors just become sick of seeing the insulin and lose sensitivity. So how does this lead to polycystic ovarian syndrome? Well, it changes the balance of other hormones, and the ovary gets kind of locked in this dysfunctional state. So what can you do about it? Well, you can change your diet, for one. So reduce carbohydrate consumption, certainly stop eating sugar, and eat a diet that is mostly protein, healthy fats, and lots of green vegetables. So that's going to be a diet that's going to help reverse insulin resistance and thus polycystic ovarian syndrome. And exercise. Exercise has also been shown to resensitize the insulin receptor, and it doesn't take that much. Going on a walk for 20 minutes 5 times a week has been shown to help. So what else can you do? Like if it's a pretty severe situation, what else can you do? You can supplement with natural progesterone. Natural progesterone has also been shown to kind of regulate the ovarian function and get the cycle happening again. This is a temporary measure, and when you get to the root of what's going on, you can usually let that go. And then there's sometimes some symptomatic therapies that you have to employ because a woman is suffering with the acne or the hair growth or the hair loss. So sal palmetto can be very, very helpful. So sal palmetto is an herb that men take for enlarged prostates, for example, but it can be used safely in women if they're not trying to get pregnant. It should not be taken during pregnancy. But sal palmetto will reduce the conversion of testosterone to dihydrotestosterone, which is what binds to the hair follicle receptors and also to the receptors on the sebaceous glands, and can lead to, acne, hair loss, hair growth on the face. So anyway, sal palmetto can be helpful, and there are definitely pharmaceuticals that can help also. But just to kind of keep the discussion around natural agents, I would say diet, exercise, if needed, bioidentical progesterone, and if needed, sal palmetto. But I've been able to help women reverse polycystic ovarian syndrome many, many times. It's in your control.